magnesium. So you generally need supplementation for that. Now, this is one thing I want to leave you with. So these are three major studies that I put together for you. The Women's Health Initiative was a very big study, as you know. It was more famous for hormones than anything else. But it's a large study, over 48,000 women, and they did the low fat, the proverbial American Heart Association diet. It was like less than 30% fat, less than 10% saturated fat, and no effect on stroke or coronary disease. Then the Look Ahead study was closed because it didn't show any benefit at all. But the PREDIMED study was the one that really put us on the map with the Mediterranean diet, and they called it a high-fat diet. Now, I don't think 40% of calories is really high fat, but that's what they use as their definition. And you can see the study was closed early because of greater than expected efficacy. So, isn't that interesting? Now, EECP I have to mention because, not just because I do it and believe in it, but I think it's a treatment that people need to know about. It's already been mentioned here before with the whole stem cell thing. But it's a non-invasive way of treating heart disease. And too many people are getting stents and bypasses in this country. Now, there's a role for it. Believe me, I'm not against it. But when I see 80, 90-year-olds going in for angioplasties and stents, when there's something that is so easily used and accessible, it gets me upset. So how it works, you have cuffs that are around your calves, your quads, and your buttocks, and it's timed to the generator's underneath the table there, and it's timed to your EKG. So every time your heart goes into a certain part of the cardiac cycle, those cuffs are being sequentially inflated and then deflated. And over a period of weeks, growth factors are released, stem cells and growth factors, and actually can build, as angiogenesis is building new blood vessels. So it does two things. It builds new blood vessels and increases the circulation of the heart, and number two, it actually decreases the stress on the heart, which is why it's great for people that have heart failure, not active heart failure, but heart dysfunction, and it improves their function. They can do more with less effort. So I always mention that, because I think my objective is always to let people know about options. So it treats without surgery. It's medically proven to be effective. By the way, it was, well, results can last for years, but here's the thing. It was approved in 1996 by the FDA, so this is not a new therapy. And then it was approved by Medicare 2 years later in 1998. So it's bona fide. And so medical advocates, which is what I propose, what all of us do, is take the road less traveled. You know, we go outside the box. We are our own medical advocates. I tell people, I'm your second opinion. Who's my first? You are. I don't know your body as well as you do, so I'm really dependent on listening to my patients, and I get them involved with their health, and I think it leads to much better outcomes. So, thank you. Any questions?
Any quick questions before?
Yes.
No, where does MK7 fit into the?
Oh, good. So MK7, all right, so you've heard of vitamin K2. There's K1 and K2. So K1 is involved with blood clotting. K2 is involved with shuttling calcium from your diet to where we want it to go, which is bones and teeth. Where you don't want it to go is the blood vessels and the heart valves. So K2 does that, and there's different forms of K2. So MK7 is long-acting, and MK4 is shorter-acting. I prefer the MK7. There's some controversy as to which one is better, but I'd use MK7. And you need to have about 150 micrograms a day.
Any evidence that it'll reduce plaquing?
I'm sorry?
Is there any evidence it would reduce?
Good question. At first, when we've known about this for a while, and I was on the bandwagon saying, I don't really see the evidence behind it. I mean, like I said, I don't want my patients to have more expensive urine, but the studies are promising that it actually helps with endothelial function. It keeps that one layer of cells intact, and that's how as long as that layer is intact, we're not going to get plaque formation and inflammation. So it's whether it really helps decrease. There is some suggestion, but we need more studies. And there's a thing called coronary artery calcium scan. So it would be nice to see over a period of 5 years, for example, do the numbers come down? So we don't have that evidence yet, but I am using it in my practice because it's benign. And like I said, I use a lot of coronary artery calcium scans. It's a very objective test. It tells us how much calcium is in the coronary arteries. So I think we will get that information soon. Anybody else?
Where's the practice? Your practice?
Where is your practice?
Oh, where I practice? I'm in Whittier most of the time. Monday, but I have an office in Santa Monica on Tuesdays. So Santa Monica on Tuesdays, then Whittier the rest of the week. Good. Thank you. You've been a great audience. Appreciate it.
Thank you. Okay, so we have one more speaker before we break for lunch. This EECP, I did 35 sessions about 20 years ago, and I just started again a month ago to start doing it. I go every Saturday. I can't tell you how fantastic it is. At my age, I have normal blood pressure, blood sugar, and this has a lot to do with it. Okay, our next speaker, I can't really say anything good about because you won't believe me. She's my wife. But I will tell you a little story. About 20 years ago, maybe a little over 20 years ago, I had a brain injury. I fell on a concrete, straight down, my head hit, the whole side of the face went black, and within a few years, my memory started getting affected, I wasn't as articulate, and I was at a conference, and this lady comes up to me and says, she looks at my eye and says, "Have you had a brain injury?" I said, "Yeah." She said, "Well, you need to do something about it." I said, "Really? What do I do?" She said, "Come over here." And anyway, she introduced me to this concept of brain mapping, neurofeedback. And I went real quickly to my wife and said, "You need to do this." She said, "I'm a psychologist. What are you talking about?" Anyway, she is amazing at implementing and making things work. She's done this in her practice, has amazing results with her patients across the board, and she's going to tell you about her successes. This is Dr. Nana Spirnia.
That was unbiased opinion. I'm really amazed that no one has any notes, and I don't travel well without. I don't know where to put this. I wanted to go over the brain, maybe not, because I know that it's been a busy morning and a great morning. Are you having fun? Are you enjoying it? Maybe we should really applaud my husband, Al Piernia, for... And I'm going to go on this. Much better. It was ordered for me. I don't want to take too much time because, yes, please. My daughter Roxy is going to click for me because I find it really annoying. Take a deep breath so you would feel a little bit more oxygen coming to the brain. And you can hold hands together, knowing or not knowing one another. That increases some good, happy hormones in the brain. The brain is all about connection. We're all about connection. And the whole story of life for us is connecting. And it's interesting that, after so many, I've been in private practice for 35 years, family, marriage, child therapist, clinical hypnotherapist, educational clinical therapist, psychologist, and then I thought that's enough. I'm in private practice, and I send my patients to take medications. And here my husband comes, and he says, "You need to work with the brain." I said, no. Brain is out of question. Because we went to school forgetting that there is a body part that is really important, and that's our brain. About 17 years ago, I started to, by force, to get into the brain, the world of brain therapy, neuroscience, and neurointegration therapy. And it's been an amazing journey, and I get emotional just telling you, and I'm so excited that we are learning about the new ways to heal the brain and body. And I think maybe we all put our money together and start the first urgent care of its kind and bring everyone's amazing revolutionary technology to help us to live a long life and have quality and quantity. The missing link in my practice as a psychotherapist was working with the brain. And this is really a breakthrough, non-drug, non-invasive, with no side effect way of treating symptoms and preventing from us getting sick, mentally ill, emotionally, behaviorally, socially not well, having learning disability, having memory issues, and getting Alzheimer's. I can't tell you how amazing it is to be able to heal a brain and work with the brain. We have 5 strategies that I want to share with you to have a stronger, smarter, and faster brain. We have, the first breakthrough is that brain is neuroplastic. I want you to remember this word forever. Neuro means brain, plastic means it's flexible. About 20 years ago or so, we thought that brain is static and it grows up to age 18 and then it stops growing till we die. And that's how medication and treatment, psychotropic medications, came to play a big part. We're not talking about not giving drugs when it's needed. We're not talking about what a wonderful job the medicine, the world of medicine is doing for us.